Risk management, identifying and assessing any potential risk in order to eliminate them and provide a safe environment for staff and patients. What is risk management? It is identifying what can go wrong within the dental environment during patient care, understanding factors that can contribute to risk, explaining to colleagues the importance of reporting incidents without having a blaming attitude, acceptance that incidents will occur and promote learning from these events, having systems in place to reduce the risk and therefore reduce incidents from reoccurring. The inherent nature of delivering dental care/treatment to patients comes with many risks. With a risk, it suggests an adverse incident may occur. This does not solely mean working with sharps, high speeds, slow speeds, but can also mean the full dental practice environment, for example, stairs leading to the reception or the surgery. Within each dental premises, there are obligations as an employer/employee that we must follow. This includes complying with all protocols, for example, hand washing, identifying patients correctly, disposal of clinical and hazardous waste appropriately, radiography, decontamination of instruments, health and safety, wearing PPE, and training on all medical devices. The principles of risk assessment. There are 4 stages for risk assessment. Number 1 being risk identification. Number 2, risk assessment. Number 3, risk reduction, elimination and transfer. And number 4, reporting and recording adverse events. Risk identification. By identifying the circumstances and opportunities that put patients at risk of harm and acting to prevent or control these risks. Being aware of the potential risks from either experience or knowledge. This process will minimise significant events from occurring upon assessment and prevention rather than reaction and remedy. Having the knowledge for potential risk events will help identify these risks. For example, sharps are placed in the sharp bins, leaving the clinician to disable their own sharps and matrix bands to prevent any sharp injuries. Mercury spillages, be aware of the spillage kit. X-rays being out of range of radiation, 2 meters, using handpieces before placement in the patient's mouth, and making sure all fire exits are clear. Risk assessment. There are many different areas that need to be dealt appropriately in terms of risk assessment. Number 1, Health and Safety at Work Act, which was implemented in 1974 to outline the legal duties that employers have to protect the health, safety and welfare at work of all their employees. This also extends to other people visiting the workplace premises, such as temporary workers, casual workers, self-employed workers, clients, visitors and the general public. Number 2, the control of substances hazardous to health. The COSH is a law that prevents the reduce of workers' exposure to hazardous substances by finding out what the health hazards are, deciding how to prevent harm to health, providing control measures to reduce the harm to health, making sure they are used, keeping all control measures in good working order, providing information and instruction and training for employees and others, providing monitoring and health surveillance in appropriate cases, and planning for emergencies. Number 3, fire prevention, training on different fire extinguishers and the knowledge on fire exits and assemble points. Number 4, radiation protection, take all precautions necessary to provide reasonably adequate protection to the health and safety of individuals who are subject to radiation exposure. The main purpose in the control of radiation exposure is to ensure that all exposures are justified in relation to their benefits, that necessary exposures are kept as low as reasonably achievable, and that the doses received by patients and personnel are kept well below the allowable limits. Provide radiation safety rules to dental personnel, including any restrictions of the operating technique required for a safe use of the particular dental X-ray equipment. Ascertain the dental personnel demonstrate competence in using the X-ray equipment and imaging software and comply with the radiation safety rules. Number 5, personal protection equipment. This is required in a clinical setting to protect the skin and mucous membranes from exposure to infectious materials in spray or splatter. Number 6, equipment maintenance. All staff must be trained on all equipment and they must be serviced regularly. Risk reduction, elimination and transfer. Identifying the risks early if not already known. Keeping up with the practice policies will reduce the risk of maintenance and equipment failure. Team communication. Have systems in place to reduce risks. Using mistakes as learning tools. And looking at previous complaints and learning from these. Reporting and recording. So RIDDOR is the Reporting of Injuries, Diseases and Dangerous Occurrences Regulations, which was implemented in 2013. This puts duties on employers and self-employed and people in control of the work premises to report certain serious workplace accidents, occupational diseases and specified dangerous occurrences. Having reports means that we can look back to see if the event is reoccurring, therefore adverse changes will need to be made. This can prevent something similar from happening in the future. It also represents proof in existence, effective policy formation, protection and support in litigation, compliance and legalisation and regulations, and management of business risks.